Thank you, Lynn. Our next speaker, Dr. Mark Greiner, is at the heart of the Iowa Alliance Eye Bank. He not only serves as our medical director, he's also a corneal transplant surgeon at UIHC, and he has other numerous accolades and responsibilities. You'll see them listed in your program. It's an impressive list. Since coming to Iowa in 2012, Dr. Greiner has pursued his interest in eye banking, corneal transplantation, and research. Dr. Greiner is committed to improving the lives of patients with diseases of the cornea and currently runs a research laboratory based at the Iowa Alliance Eye Bank. It focuses on corneal endothelial cell metabolic function, and the endothelium is that back layer of cornea cells that Larry was talking about, and also corneal surgery outcomes. Dr. Greiner strives to be the best possible steward of the gift of cornea donation. This afternoon, he'll share both his personal and professional perspectives. Dr.
Thank you, Esther, for the introduction. Good afternoon, everyone. Thank you for being here. Thanks to literally every one of you here and not here that allow me to be able to share what I'm about to share with you. So I'm grateful just to be up here at this podium today and to share with you in celebration this deep and meaningful spirit of giving that is at the absolute core of organ and tissue donation and transplantation. I speak to you now not as the Iowa Alliance Eye Bank Medical Director, nor as the Eye Bank Association of America's one of the board members, not even really as a cornea transplant surgeon, even though that's kind of what the talk is built in. I'm speaking really today as the son of a cornea donor, and I want to share my dad's story and my story of his cornea donation. I really just think that this is an important story for me to tell. My dad, a warm but picky sort of individual, sharp wit, dry sense of humor, began to get sick in 2016. My family and I decided that it was the best thing to move him from California, here to Iowa City, so that we could be here to check on him, to get him to his medical appointments, to spend time with him, to be with him. We enjoyed just a little bit less than a year with him. It was a fantastic year, though. I'm so grateful that we had it. Before he fell ill suddenly with a respiratory infection. He had battled all sorts of medical illnesses for years, and so he had already really made his peace with the inevitability of dying. But as it did to all of us, his sudden turn for the worse and a trip to the ICU took him by surprise. As a doctor, I knew he wasn't going to make it. But his doctors were able to reverse his stupor just long enough for my family and I to say goodbye to him. I'm eternally grateful for that. And so when he said to me, "Looks like it's curtains, huh?" I answered in honest, "Yeah, Dad, it looks like it." I brought up the opportunity of organ donation. And after he said in his most true self that he didn't think his body parts would be worth a damn to anyone, I reminded him, "You know, Dad, you could give your corneas to someone. You think someone will want those?" He asked. "Yeah, Dad. Even if they can't go for transplant, they can go for research. They can go for teaching." And so he said, "Okay, I'd like that." And I said, "Okay, Dad, I'll make it happen." My family and I were able to say goodbye to him, a gift too many just don't get. And after Dad died that Saturday, I set about the task to make his donation happen. Like Dad wanted, I gave the donation center that Saturday all the detailed medical and social information they needed to help my eye bankers determine his suitability for transplantation. That Monday, I accepted the tissue offered to me by the eye bank as the transplant surgeon, his tissue, for my upcoming surgery. And that Wednesday, I transplanted Dad's cornea into my patient. Just like Dad would have wanted, I did what I always do. I taught, I guided my fellow as she worked. I didn't mention anything to anyone in the room that day until after I took a small and silent pause of acknowledgement that I got it done, both for my dad and for my patient. I think the hardest part of sharing this story with you is the why. Why should it be that I'm telling you this story today? Maybe it's that you should know that surgeons like me exist, and that I take the same custody and care of your loved one's gift as I did my own. Maybe it's simply that I can tell his story, and thus I need to. Maybe it's because this rare twist of fate placed me on the crossroads of donation in an amazing and special way. One way or another, I want you to know that I share with you the awe and gratitude of the gift of donation, the gift of sight, and the love for all things in the world that come from good places such as this. Thank you.